Recently, we joined many healthcare and industry peers, both in our region and across the country, and created an employee policy that requires COVID-19 vaccination or an approved exemption due to medical or religious purposes. We are doing this to maintain the safety and well-being of the entire Michigan Medicine family, our patients, our colleagues, our students and trainees, and our communities, as we see COVID-19 case counts rising again and new infectious variants emerging. This decision was not taken lightly, and we recognize there are many different opinions about this controversial topic. So to increase transparency, a few of our leaders want to share more information and answer questions that we realize do need greater clarity.
All students, faculty, and staff on the 3 U of M campuses, including Michigan Medicine, must have submitted vaccination information to the university no later than August 30th, requested an exemption, or received their first shot. This includes remote employees. For all staff covered by a collective bargaining agreement, the provisions of the collective bargaining agreement shall apply. Those who receive their vaccination through a Michigan Medicine clinic and/or provider can pull their COVID-19 vaccination report from the MyChart patient portal. Every staff member and learner needs to show proof of receiving the vaccine through the form available through Responsive Blue. The exemption form can be found on the Wolverine Access in a link entitled UM COVID-19 Exemption Request. Workforce members who are not fully vaccinated and have not submitted an exemption request by August 30th will be considered non-compliant with the required vaccination policy. You will be expected to begin your vaccination process and conduct weekly COVID-19 testing until fully vaccinated. A vaccination deadline will be established, and non-vaccinated employees will follow the discipline or other process applicable to persons in their classification of employment.
Occupational Health Services on the main medical campus continues to offer COVID-19 vaccinations on a walk-in basis, or you can schedule an appointment at one of our vaccine clinics through the MyUM Health patient portal. You can also get your vaccine at a local drugstore or the county health department. The university is actively discussing vaccine requirements with each of the unions representing staff on the UM campus and Michigan Medicine, whose agreements require those discussions. We are hopeful that agreements can be reached in support of vaccination. All workforce members are required to be vaccinated or have an approved exemption, regardless of work location. This is a requirement across all employees to promote community safety and equity. If you've only received 1 dose of a 2-dose series by August 30th, to be compliant with the Michigan Medicine policy, you will need to complete weekly COVID-19 testing until you are fully vaccinated, which is 2 weeks after your second vaccination. You will need to submit documentation after you complete the series.
The CDC and World Health Organization recommend vaccination regardless of whether you already have had COVID infection. That's because the duration of immunity after infection is unknown, and it may be variable, especially after asymptomatic infection. On the other hand, we do know that the vaccine is very protective. Studies have shown that vaccination provides a strong boost in protection in people who have recovered from COVID. In addition, people who were previously infected with COVID might be susceptible to the new variants, including the Delta variant, while people who were vaccinated may be more likely to be protected. Employees who do not submit proof of vaccination or have only received their first dose of a 2-dose series by August 30th are required to participate in weekly COVID-19 testing until completing the vaccination series and providing documentation. Unless an employee submits and receives an approved medical or religious exemption, they must be vaccinated to comply with the vaccination policy. Those who are granted an exemption will still require weekly testing. The weekly testing will include saliva testing administered by the Campus Community Sampling and Tracking Program.
Those working or training here for a limited time frame will still need to be vaccinated, similar to temporary employees and contractors. They can utilize one of our vaccine clinics or any other community resource. Some examples include, but are not limited to, a documented history of a severe allergic reaction to any component of a COVID-19 vaccine or to a substance that is cross-reactive with a component, a documented history of a severe allergic reaction after a previous dose of a COVID-19 vaccine, documented history of myocarditis after first dose of mRNA vaccine, and previous history of multi-system inflammatory syndrome secondary to COVID infection. If you are pregnant and concerned, you may request a medical exemption to defer your vaccine during pregnancy and receive your vaccination after giving birth. People participating in clinical trials or studies will still need to submit a request for an exemption and explain their situation. A highly vaccinated workforce provides the safest environment for workforce members and patients. The circumstances of the pandemic, with increased COVID cases and development of a more transmissible variant, means there is urgency in vaccinating all who are eligible in order to prevent further COVID infections that may be associated with severe disease or hospitalization. There is robust safety and efficacy data that has informed the emergency use authorization, and hundreds of millions have received COVID vaccines since the FDA emergency use authorizations were issued.
More information can be found on the Headlines website. Just search for required COVID-19 vaccine FAQs, or refer to campus's Maize and Blueprint website and click the FAQs tab at the top of the page. We will be continually updating the FAQs, so please bookmark that site. Widespread vaccination is the most effective way we will combat and keep the pandemic under control. Please do your part, not just for you, but for your families, colleagues, and communities.
The University of Michigan remains united on all three campuses in Flint, Dearborn, and Ann Arbor, and committed to widespread vaccinations for our faculty, our staff, and our learners. Michigan Medicine has dealt directly with the devastating toll of COVID-19 on our patients and our organization. For more than a year, our teams have responded to surges of acutely ill COVID-19 patients while still providing life-saving health care for the thousands of patients with other acute medical and surgical needs. This mandate will increase vaccination among our healthcare personnel, and that is critical to Michigan Medicine's commitments to the safety of our patients, their families, and our staff. Thank you for your continued commitment during this unprecedented public health crisis facing the entire world. We will beat this pandemic by working together in the best interests of our workforce, our patients, and our communities.